Hello everyone, I'm going to demonstrate sawbone demonstration. It's a sawbone demonstration of how to use a Tornier Perform reverse shoulder arthroplasty instrumentation. So basically, if you've got a case for a reverse shoulder arthroplasty and you plan to use Perform Tornier, you're going to ask for the instrumentation. So this is what you get. There are almost like 8 boxes, 5 boxes for the humerus and then 3 boxes for the glenoid. So we go and look carefully at individual boxes. So basically, when you want to do a reverse shoulder arthroplasty, there are a couple of components which you need to implant in the body. So on the glenoid side, you get this glenoid base plate. So the base plate is fixed to the glenoid with the help of these screws. So there is a central screw and then the option of 4 peripheral screws. You can go for either 2 or 3 or 4 depending on the bone. After that comes the Glenosphere component, so that gets impacted into the base plates, and then there is a screw option. You can screw it in. On the humeral side, you get this humerus stem and this poly liner, poly insert. So that gets snap fitted into the stem like that. So overall, that's your entire reverse shoulder arthroplasty. So we're going to look at each sets now and see how we do. This set has all the humerus stems along with these 4 your different type of liners. So in stem you got options of size 1, 2, 3, 4, and each size has got standard, plus and plus long, and then in size 2 and 3 you got extra long stem, which is like in your revision stems you can use this. Then in liner, there are various sizes of liner. So it goes in 33, 36, 39 and 42. Every size has got plus 0, plus 3 and plus 6. That increases the liner thickness. And then there are 2 varieties, like these standard liners are 135 degree angle, and then it also has got 145 degrees. So that's 145 degree. If you want to change the neck shaft angle, you can go for this. These 2 trays are for instrumentation, how to implant those components into the humerus, and this also gives option for anatomic shoulder replacement. So these are the different heads for anatomic shoulder. So these 2 sets are for glenoid implantation. Now these are the instrumentations and these are trial. Now on the trial side, you got different options. So 33, 36, 39 and 42. Everything comes in different thickness, which is like plus 0, plus 2, plus 3 and plus 4. And then there are also options of lateralized glenoid. When you do your reverse shoulder arthroplasty, you do your deltopectoral approach or deltoid split approach. You do a soft tissue releases, and then your humerus is out. You dislocate your shoulder. You take the humerus head through the wound. Now then you start with the humeral head preparation. I'm not going to go in detail with the soft tissue portion. I'm just going to jump onto the bony portion and instrumentation. So once your humerus head is out, your first step is to prepare your central canal tip. So which comes exactly at the top edge of your humeral head, which is slightly on the cartilage region at the almost 5 millimeter or 1 centimeter medial to the cartilage bone junction. So you get the top portion of the humeral head, and then you go inside with your guide. Now once you go inside with your guide, it gives you option to use this for your neck cut. Now a few people will do it freehand. If you're not experienced enough, you should use this rather. So once you've gone in, and then you decide which is your plane of your neck cut. Ideally, I would go slightly onto the cartilage side, not go onto the bony side. So I think that's optimal. I would lock it in. So it gives 135 degree angle. Now, when you look closely on this guide, you get these holes, which gives you anti-version angles. So ideally you would like to have some 0 degree, 10 degree or 20 degree angulation in your neck cut, retroversion in your neck cut. So I'm doing the left side. So my personal preference, I go for 20 degree. A few people will go 10 or 0. So I'll go inside And this rod, once you locked in, this rod should be perpendicular to your forearm. Okay, so once you made sure of in line with your forearm, once you made sure your guide wire, your anteversion rod is in line with the forearm, then you can fix these two slots in. So can I have that center pin? Yeah, so that goes in here, 0 degree. So once you've gone that, now you can take out this whole guide. Now that gives you plane for the neck cut. I'm gonna have the saw blade. Now if you want to increase or decrease your neck cut angle, you can come out with this. You can push on these holes, so your neck cut is less than 0. So you're leaving a +2 millimeter of bone onto the head. So make sure you flush on the bone on the guide here. No, I think it's a decent cut. Maybe I can go a bit more. Decide which side of the humeral head you should opt for. So you take this, you put it on the bone. Now, when you put this on, you have to make sure you're not onto the cortex. You're going to leave a bit of cortex on the sides. For example, if you go for size 2, yeah, so that feels better. So you're leaving a rim of cortex around, you're not on the cortex. But yeah, you're covering the entire head. So I would like to go with that. Right now, I would go for a protector instead. Do we have the protector? Yeah, so that feels better. Now, pause. Once you're sure with the size of the humeral head, you have to get these protectors in because after this, I would like to go to the glenoid side and do my glenoid bits. So I would like to put this and push this in so that protects my humeral head from destruction while I'm doing the glenoid. So that's done. Now time is to go back to the glenoid. You prepare the glenoid. It goes in steps. You put guide wire first, and then after your reamer, and then you ream for the central post, and then you put drill for the screw, and then you put your base plate and the Glenosphere. So the first step to find where you're gonna put your guide wire. So what I do is make a plus sign on the face of the glenoid. Now we know that a reverse shoulder base plate comes inferior to the glenoid, it's not in the center. So roughly this point is my center. So I would like to go a bit more inferior to that, somewhere here. Now there are two options of glenoid guide, two inclination actually. So if you look carefully, one is like 0 degree, one is 10 degree. So now inferior inclination in the glenoid is preferable to superior inclination. So my personal preference to go with a 10 degrees inferior inclination. So when you position your guide wire, guide over to the glenoid, make sure the inferior edge of the guide is flush with the inferior edge of the glenoid, just to avoid any sort of impingement on this. So can I have that reamer in my hand? So again, make sure you flush there, and then you go ahead with a guide wire entry. So again, we're going inside. So you have to keep on going till you feel a give way. So here I've come out. Now your assistant takes the reamer off, and then you can come out with this. Then can I have the peripheral reamer? So now the idea behind reaming the surface of the glenoid is to avoid going to the subchondral bone in all the sides. So you should ream all the cartilage off, and then just a touch of bone, the cortex. As soon as your subchondral bone comes out, you should stop. When you really keep looking at how much you have reamed. So here I think we have done a satisfactory job. So if you look carefully, the inferior surface is completely reamed. Some of the osteophyta is still there. We can remove that. Superiorly, we have not reamed at all, but I think this kind of flush, so we'll leave it there. Otherwise, our more of subchondral bone will be exposed, and that will be not be very good situation for our base plate stability. Now, can we have that central reamer? Now, when you look carefully, there are two options of central post reamer. One is short and one is long. So, in case of like osteopenic bone, when you are struggling to get hold, you can go for a long post. When you have to ream for this. Otherwise, this is the standard post. You can use this one. So again, feed that into the guide wire, and make sure once you have drilled it, once you have reamed it, the flat surface should touch the bone. I think we are okay there. Next will be your, you have to remove this guide wire. So this is your guide for the central screw. You have to make sure that goes inside, and this surface is flush with the bone, and that goes completely. And then you start with the central screw drilling. Now, when you look at the edges, the laser mark on the drill, they are marking off 25, 30, so every 5 millimeter increment. So you can measure the size of the screw based on your drill. And as soon as you have to give way, you stop. And there. So that's roughly measuring up to 35. And then you got this also in case if you want to measure with this. So you go inside. And that's roughly, option of 9.5 also in case if you get some weak bone. Otherwise 6.5 is the standard one. So you put that inside, and then hold the base plate with the holder. Make sure you have a nice grip on this, and thereafter you push this inside and go anti-clockwise. You can see the direction of the anti-clockwise here, so that will guide you that which way you should go. And while doing this, the base plate will drop onto the screw, and then we had the giveaway, and that's it, done.
Start.
So your base plate and the screw assembly is ready. You're ready to implant. Now what you should do is you get this screwdriver. Now you should put the screwdriver inside. Make sure you onto the screw, and thereafter you start screwing it in. Can you hold the saw bone again? I think we are down to the bone, and then you can come out easily, and then you remove the guide. You can check with different instruments if you've gone down to the bone, and there you are. So you're flush on the bone on all sides. So your base plate is in. Then comes your peripheral screw. So there are 4 options. Now there are 2 superior and inferior locking options, and then 2 anterior posterior compression screw options. So ideally with this long screw, 6.5, the base plate is compressed on the bone. So what you should do is you can use just 2 screws for the lock. You lock the base plate inside. Now usually in the primary setting, I tend to use only 3 screws, 1 central screw and 2 locking screws. But in case of revision, I tend to use all the 4 screws along with the central screw. So to do this, important thing is to note which direction your screws are going. So my inferior screw, which is going there, I tend to go along the lateral scapular border. The topmost screw, I tend to go in between the coracoid process and superior edge, and these two straight. So first one I would be putting as inferior, because the issue is if you go for superior screw option, there is a chance that you can compress this compress the base plate superiorly, and which will increase the superior inclination. So inferior first. Now when you look at this, when you push the drill sleeve in, it gives you around 20 degrees of freedom in terms of angulation, where you can angulate your screw. So I would go inferiorly. Just make sure you don't come out of the bone before going inside. So that angle, I believe I'm okay there. Now there are 2 options. Again, the drills are laser marks, where you can note what's the depth of the screw you're going to use. So I've gone till 43. I think I got some giveaway. Yeah, now I'm coming out, and that's pretty long screw. Pretty happy with that. 54 size screw. So we can go for 54 size locking screw. So can we have that locking screw? So it's the same screwdriver for all the screws. I'm getting solid fixation in this, so I'm pretty happy with the fixation here. Sawbone again. Yeah, sometimes putting these are a bit difficult. You can ask your assistant to do that if you're tired. So I would not lock it finely at this stage. I would start drilling the superior screw again. So as I said, I would aim for superior glenoid and coracoid. So angulate it slightly superiorly, which is the best bone in the glenoid. So here I've come out, and that's measuring around 42. So that will be our size. Can you hold the sawbone? Now, the important thing with this Tornier locking mechanism is, as you go down, these things will open up a bit. So you should go for the maximum click. Okay, so I think your base plate is nicely secured, and thereafter you have to go for Glenosphere. So you should decide in your pre-op planning which Glenosphere size you're going to use. You got different size of Glenosphere, so pre-operatively you should decide which size you're going to use. I think in smaller patients you can easily use 36 size, and then unfortunately we got only one eccentric Glenosphere here, so we're going to use that. Otherwise you can straight away go for a standard base plate. So the way to implant this Glenosphere onto that base plate is you feed this into the screwdriver. And this can be a tricky part, just because your humerus is in the way and you're going to impact the whole big glenosphere, so it can get tricky. So ideally what you should do is you just hold the side and then take it over there. One trick is to use single retractor on this side, and as soon as you going inside, as soon as you have hooked the tip of the glenosphere onto that hole, you ask your assistant to remove the retractor, and then after you flip it down. Okay, so I think I've done it. So I'm gonna screw this glenosphere onto the bone, onto the base plate. Now once you've done that, another trick is like you get this one, the impactor, and give 2 taps, and then get back to the screwdriver, and then back again, 1 more. And you want to make sure that base plate and the glenosphere is nicely fitted in. Now I think we're done with the glenoid base plate and the glenosphere. We go back to the humerus now. So we've done our glenoid. Now we come back to the humerus. So we remove our protector sleeve, and then we get our size 2 onto the humerus head, making sure we are right in the center. So I believe that's the center. Can you hold on? Now next is you push this guide wire into the central slot. So as soon as you are out from the humeral cortex, that's it. You should come out then, and that comes out. Now these wide things are for you to hold and make a grip. Can you hold the saw bone again? So you have to make sure that your reamer is touching. So I think we're done there. So once you've done your metaphyseal reaming, you get this guide in for your canal reaming. Make sure it's flush to the bone here, and the hole is aligned with the central hole, the humeral canal. And then again, so this reamer comes for size 1 and 2. Again, it's color coded purple. So you take that and then go inside, and you should go manually. Just keep pushing, rotating, gently rotating. Once you've done that, thereafter you come out and then start broaching. So I have a broach for the size 2 standard. So we have 3 options: size 2 standard, and then 2 plus, and then 2 plus long. So we go with the standard size first. Now these are the broaches. So again, size 2. We got option of size 2 plus, and then plus long. So we start with a standard size 2. Now we had done retro version of 20 degrees, so I'll get my guide in again over the 20 degree guide. Okay, align that with my forearm, and that gives me the right angle. Now you go in. The top one is to push the implant laterally so that you avoid virus. So I think you've done your stem in, and thereafter the option comes for insert. So my routinely I use 135 degree. So can I have that insert trial? So we're not opening the standard, the real implant, so we're gonna go with the trial. So now you got 2 options of neck shaft angle. One is like 145 degree, 135 degree you can change. So I would go for 135 in this case. Now if you read through, it's along the dial of watch. So it's 12 o'clock. So if you see there is a trough here on the liner. So that will align with the 12 o'clock. So you go inside, make sure you're there, and thereafter can I have that pusher? Yeah, and the mallet. So once you've done that, can you hold on to the sawbone? And so our humerus is done, and can we have our glenoid? So that makes the entire construct of Perform humerus and glenoid implantation. So that's it, done. And once you've done that, you're going to assess the stability of the shoulder so that it doesn't dislocate. And also you're going to assess if there is an impingement along these inferior edges. So they are the classical ones that leads to impingement, and that can cause dislocations. To remove these osteophytes, there was one step which we missed. There is one peripheral reamer. Where is it? Yeah. So that's a guide. So these things are made to ream the osteophytes from the periphery of the base plate. So I'll just go through once again to show you how to do it. So I'm going to remove the Glenosphere. Right now it was difficult to extract the Glenosphere, so I've used this instrument, and then that extracts the Glenosphere out. Yeah, so the peripheral reaming happens once you have put the base plate in. So you get this in, and then after whatever is there, you just take them off. Right now there is nothing because it's quite lateralized and there is no much osteophyte, but that's how you should remove the osteophytes before you go into the base, go into the Glenosphere. So I think start. So I think that's it. We done the glenoid, we done the humerus. Once you've done that, you reduce the shoulder in, and then check the movement, check the stability, and then complete the closure of the deltopectoral or deltoid split approach. And then yeah, that's it. That's how you should use your Tornier Perform instrumentation. So all the best. Any question, any queries, please do get back in touch with us. Thank you very much.